This is the 559th Remote Area Medical Clinic.
At 6 a.m. in the hills of eastern Kentucky, Stan Brock opens the doors to his Remote Area Medical Clinic, or RAM.
It's a small crowd, so everybody's going to get seen.
Normally there would be 1,000 people in line waiting for free medical care. Below freezing temperatures brought out a smaller crowd.
Fixed, cleaned, fixed, filled.
Stan Brock founded Remote Area Medical 23 years ago to bring care to developing countries. Soon after, he went to a rural county in the U.S.
And so we were asked if we could go up there with a few dentists, because they had a lot of dental problems in the area. And we did, and were surprised by the turnout, and from there it just grew.
Several times a year, RAM sets up its remote clinic in places like Knott County, Kentucky, for a weekend. Known for its rolling hills, this is coal mining country. Many residents work low-wage jobs and cannot afford to see a doctor.
Lamps go on the table.
RAM depends entirely on volunteers. On this weekend, 6 eye specialists, 24 dentists, and an assortment of other physicians and volunteers will treat almost 1,000 patients.
I think you're supposed to open up out here around 6. Okay.
At 4 a.m. Saturday, the parking lot was already bustling with activity. Danny Sloan and his family have been waiting all night.
I'm looking for some eyeglasses and a cancer screen.
Number 1. Number 2.
In the U.S., government-provided health care is more easily available to children than adults.
Here, they're going in line.
Most of the people here have jobs, but still cannot afford health care. James Francis is unemployed. RAM is his only chance to see a doctor.
I said to my girlfriend, I said, well, I need to get up about 4 o'clock and get up there. And then when I got here at 5, I was like number 82 already. So, you know, that shows how important this was, you know. And then here I thought, you know, well, I'm going to get there to be the first one to get in line, you know.
Nearly 46 million people are uninsured in the U.S., but Brock says he sees many who have insurance. The most common need is for dental and eye care.
They have insurance, but it either has a very high copay, and so they can't afford the copay, or it doesn't cover those 2 essential services.
That's what we were just talking about.
Later in the evening, Kentucky Lieutenant Governor Daniel Mongiardo, a physician, stopped by to talk with some of the volunteers. The topic quickly turned to why so many people in the U.S. have no access to health care.
The healthcare system is broken. It doesn't matter who pays for this inefficient, very expensive system. The problem is the system costs too much for anybody to be able to afford.
Is that what you're saying?
After hours of standing in line, after all the poking and prodding, patients like Sandy Eckridge leave with more than just fixed teeth.
Smile, teeth, and glasses.
Oh, those are pretty. Did you try those?
Remote Area Medical plans more expeditions in the U.S., as well as Africa and South America. Jeff Swicord, VOA News, Knott County, Kentucky.